One of the most important reasons for this displacement are clenching and grinding habits, mostly because of the muscle tension of masticatory muscles, most importantly, temporalis and masseter. What are the symptoms of grinding or clenching which can cause this displacement? Any type of the muscle tensions can cause actually grinding and clenching habit. That's why we can have any type of the muscle spasm, kind of like a pain, jaw pain, toothache, any type of migraine pain can be part of the symptoms. With disc displacement with reduction, because articular disc pops back to the right place, we have clicking and popping. In disc displacement without reduction, because articular disc does not pop back to the right place at all, sometimes we have a lockjaw.